Acne is a common skin condition that often develops on the face, back, or chest. It causes spots, oily skin, deeper cysts, and sometimes skin that's hot or painful to touch. Acne can look different from small spots to large, painful lumps. Here are the common kinds of spots you might see. These spots start where hair follicles and oil glands interact, and the appearance depends on what is happening under the skin. Now the main types. Blackheads, small black or yellowish bumps on the skin. Whiteheads, similar to blackheads but usually closed and firmer. Both are common and often appear where oil builds up. Papules, small red bumps that may feel tender or sore. Pustules, like papules but with a white tip caused by pus. These are inflammatory spots and can be painful. Nodules, large, hard lumps below the skin that can be painful. Cysts, deep, pus-filled lumps that can lead to scarring. Many people experience different types together. Treatments depend on the severity. Acne can appear at any age but is most common in teenagers and young adults. It may be limited to a few spots or cover larger areas like the face, back, and chest. If you have symptoms, speak to your pharmacist. They can look and diagnose acne. They assess how many spots there are and how inflamed or painful they are to judge severity. Your pharmacist will tell you if you need to see your GP for further treatment. Seek medical advice if you have many papules and pustules or painful nodules. Severity guides treatment choices, from topical creams to oral medications. Treatments often include creams you put on the skin or oral medications. A pharmacist can prescribe or advise on these. If treatment doesn't work, they may refer you to your GP. Be patient. Acne treatment can take several months to show improvement. In women, acne can be linked to hormones. It may flare around periods or with PCOS. If suitable, the combined oral contraceptive pill may be recommended and can help over time. It can take up to a year for the full effect to be seen. For severe acne, GPs may refer to a dermatologist for specialist care. Diagnosis is usually clinical. Your pharmacist or GP will look at your skin and symptoms. They count spots and check how inflamed or painful they are to plan treatment. Severity determines whether topical creams, oral antibiotics, or specialist drugs are needed. Topical treatments include benzoyl peroxide, retinoids, and antibiotic gels. For moderate to severe acne, a combination of oral antibiotics and topical treatments may be used. Your care team will explain options and duration. If these don't work, isotretinoin may be considered for severe acne. This medication has specific risks and requires close monitoring by specialists and GPs. Your healthcare team will discuss suitability and safety. Wash affected areas with a mild cleanser and lukewarm water. Avoid very hot or cold water. Use fragrance-free, water-based products on your skin. Avoid heavy makeup and remove it fully before bed. Do wash the affected area with a mild cleanser once or twice a day. Do use fragrance-free, water-based skin products. Don't wash more than twice a day, and don't squeeze or pick spots. It can cause scarring. If in doubt, ask a pharmacist or GP for advice. Acne starts when sebaceous glands make too much oil, mixing with dead skin cells and blocking hair follicles. Blocked follicles can become infected by normally harmless skin bacteria, causing inflammation like papules, pustules, nodules, or cysts. This is why some spots are painful or deep beneath the surface. Causes include hormonal changes, especially during puberty or around periods. A family history increases your risk. Some cosmetics or medications can contribute. Pressure or friction from clothing or gear can worsen acne. Smoking is also linked to acne risk. There's no evidence that poor hygiene or sexual activity causes acne. Washing too often can irritate skin and make acne worse. Acne can lead to scarring, especially if nodules or cysts burst or if spots are picked. Avoid picking, it increases the risk of permanent scarring. Acne can affect mental health. You may feel anxious, stressed, low, or depressed. Speak to your GP practice if your mental health is affected. Support is available. If you have acne, start by asking your pharmacist. They can advise and treat many cases. For more information, visit your healthcare provider. You are not alone.